I want you to imagine that you've moved to a new city and that you're just trying to find your way around. There's no landmarks that you're aware of. There's no real awareness of roads that are pretty common to everybody that's lived there. And you're just trying to find your way around. Well, that's how I would compare using ACT as a therapist. When you're first learning this, even as a client, you can kind of just have this lack of awareness of where do I go from here? And so I wanted to develop an ACT roadmap for those that may have gotten lost, whether that's you as a therapist, you've been in sessions where you're trying to utilize acceptance and commitment, but you find yourself getting confused as you're sharing this material. Or maybe you're a client whose therapist has used ACT and you're wondering how it all connects. So I wanted to give you a lay of the land, kind of a map to help you to kind of figure out how to use ACT more effectively, more fluently, so that you can get where you want to go. So whether you're an ACT therapist or whether you're in graduate school trying to figure out if ACT is the right method for you or therapeutic modality, or if you're a client or somebody that wants to improve your own mental health and try to figure out how to stop struggling and learn how to accept and let go. This is going to be a really, really good course for you. So I'm going to offer you an ACT roadmap, which is going to be a 10-session step-by-step guide. Now, with ACT, we don't necessarily use manuals or protocols when it comes to diagnostic categories. We kind of use these processes, these 6 core processes where we kind of bounce around and just depending on the client in front of us. However, I have found that when you first start out as an ACT therapist, you kind of need that ABC approach. I mean, don't get me wrong. I definitely am all for using these processes over the protocols. But I think when you're starting out, or maybe you're an experienced therapist, you just haven't really given ACT, the full go. Maybe you've taken a training or two and you kind of get the gist of it, but you really don't know how to utilize it in a session or throughout several sessions. And so I'm going to use this ACT roadmap to kind of give you a generic protocol that you can use either from session 1 to session 10, or you can use to supplement in your therapy practice. And I think if you're a client, you're going to find these videos really, really helpful to reinforce what you've learned in therapy. And I think for my own clients that I will share these videos with, I use these maybe 10 to 20 minute windows in a session to teach ACT. And I can't expect anybody to just absorb it once and then practice it. So we need reminders. Even I need reminders. And I use plenty of ACT resources, other teachers to help just get myself back into that learning mode. So that's kind of a long introduction to kind of tell you where we're going to be going. So when it comes to therapy, if you've never been in therapy or maybe you're learning about therapy, there's something called an intake. And this is not necessarily the first session. This is session 0 for me. This is where I get to know the client, kind of get to know the presenting issue of what brings them to counseling. This is where I use an informed consent to introduce myself as well as the therapy process. And this is where I introduce ACT. And then I get to know their history. And there's some things that as a clinician that I'm looking at to say, okay, what does this client need help with? Are they trying to control something? Or are they trying to avoid something? And so usually I can figure that out within the first few sentences as I ask them a pretty basic question of what brings you to counseling today or at this time. And I can kind of tell where I'm going to be going with them. However, when I get to their history, I'm doing more of a functional analysis. So it's kind of a fancy way to kind of look at the ABCs of behavior and trying to figure out, okay, well, what is going on? Where's the client at today? Like, what is the behaviors that they're either engaging in that are shrinking their life? So maybe it's control or avoidance of some sort of discomfort or psychological pain? Or is it some sort of control? Are they just having a lot of rigidity? Like there's not that psychological flexibility that ACT seeks to promote. So I'm trying to find out where they're at today. So that would be their B or behavior. And then I'm trying to find out what happened before. Like, what are the important highlights that you want the therapist to know before we get started? And a lot of times, they might start in their childhood, but a lot of times they're starting with where this problem began. And then they're giving me some important highlights along the way. So sometimes you might get some really important details, like maybe they came from a family with high conflict or divorce, or maybe they've had a betrayal, or they've had maybe a panic attack or car accident. There might be something there that you say clinically, this is really relevant to the picture. So we want to know where they're at today, that behavior, where they've been, or the antecedents. And we're kind of looking more historical as far as the antecedents go. And then we're looking at the consequences. So usually with a clinical diagnosis, there's at least one area that is impaired. So you could think of it like big important areas in life, such as relationships, education, school, I guess education is school, work, friends. There's something that is, or health. There's some big area that has been impacted by this problem, and so I want to get an understanding of that. In there, you're probably already going to get a few of the things that will go into session one, as far as what they've tried and kind of what that problem really has cost them. But I think as far as session zero, you're really looking at that functional analysis, that ABC of their behavior, so that you can start to get a head start when you work together. So one piece that I want to include in session zero is that you want to set up and introduce ACT. So the way that I do that is I do that during the informed consent. So I don't know how you do that if you're a therapist, but the way that I do that is I get the presenting problem. So it's probably the first 5 minutes of a session. Once I get that and I've repeated it back in one sentence that's really clean and clarified, and the client agrees, that's why I'm coming, then I move into the informed consent. In there, I'm going to introduce myself. So I say something like, so let me start with my credentials and what gives me the privilege to work with you. I'm what they call a licensed mental health counselor, which is kind of a jack of all trades when it comes to mental health disorders. So I'm more of a generalist. So if you're looking for a specialist, I may not be a good fit. I do specialize in a few areas, so I'll go over those, as well as I have some limits. And then I mentioned the three to five specialized areas, depending on if it's a child, an individual, a couple. I'll kind of mention those. As far as individuals, I focus on anxiety, depression, ADHD, and mood regulation issues. And then I sometimes will include men's issues as the fifth category. Those are kind of the ones that I say that I've gotten a lot of training in and can help with. And then I say the limits, and you may have different limits, but I would say those that require a more specialized person. So things like eating disorders, because of the high lethality risk, I will refer out if that's the main reason that they're coming. And a lot of times it's not because I don't know how to work with them. It's that I don't do it enough to where I would say that it's within my scope of practice. I may include autism in there too, because a lot of times it requires behavioral analysis or ABA therapy. Not always. I do work with people on the spectrum, but I don't advertise myself as somebody that works with autism. So you would have your own strengths and weaknesses, but that's kind of how I introduce myself. And I also give you may not agree with this, but I give my own background. I say something like, I have 20 years working with people as a professional, 5 years as a counselor, where I've been working with people like you, and I have 15 years of full-time ministry. So I may be a plus, it may be a minus. I say that not to that I impose my beliefs or values, but you kind of know who's sitting across from you. A lot of times I have a tell. I don't know, people can just kind of spot it that I'm kind of a little different, so I like to call those things and introduce myself. And also, I want to avoid surprises. I think the informed consent's a really good opportunity for a therapist to set the stage. The second part is the therapy process, which I'm not going to go through all those that I mentioned. I have a few, but the one that I do to introduce ACT is I say I have a couple of evidence-based therapies that I use. These have been research back to help with particular issues, and these are things I've received training on. ACT is one of those. Now, acceptance and commitment therapy has two parts. There's the acceptance part and the commitment part. So let's talk about the acceptance part. Acceptance isn't meant to refer to giving up or a resignation, that this is just the way things are. Acceptance is all about a acceptance of reality. It's this is what is happening. This is what is showing up, and it's a willingness or an openness to engage with reality. So what that means is my thoughts and my feelings, anything that I'm experiencing in this moment, I recognize that that is what is going on. I acknowledge it, and I let go of that struggle to have that. Stephen Hayes, the founder of acceptance and commitment therapy, has a famous line that says, the more you don't want something, the more you have it. And I think there is this paradox that the more we resist and we don't want to have these things, the more we end up having them. And clients at this point were usually nod and they're very engaged with that. I think they find that to be true in their experience. So that's the acceptance part. We learn to let go and open up to reality as it is, not as what we want it to be. The commitment part is a commitment to a values-based life. Now, I don't decide what those values are, but that is something that you as the client, you get to choose. So those would be the things that are important to you, the kind of person that you want to be in life, how you want to feel about yourself, how you want others to respond to you. Those are like a compass. They're your direction in life. And what I do as a therapist is I help you to take committed action toward those values, even with the stuff that shows up. So the thoughts and the feelings, all that stuff that's currently there, to bring that with you. So that's the acceptance and the commitment part. So it's something I really like to emphasize. I don't go too much into it, just giving a brief introduction to what I use to help clients. At the end of the session is kind of another important part of the I guess session 0, to set up for session 1. I say something like, hey, I don't want you to do anything different between now and the next time we meet. There's not going to be any homework, and there's nothing I'm expecting you to do. The only thing I'm asking is that you notice what shows up between now and the next time that we meet. Okay, so I want you just to take just a mental note of the thoughts, the feelings, and the sensations, those things that are showing up in your life. And I want you to come ready to share those things with me at the next session, okay? And they usually like that there's not a lot of homework. However, I have now added another resource that I do send. I tell you something like, so I don't want you to do anything, just notice. I am going to send you a resource called Doing What Matters in Times of Stress. This has 5 tools that I find that are just helpful for mental health hygiene. And these will be some things that I'll cover throughout our therapy time. But I want to give this to you on the front end so you have it. And I'd recommend just opening up the ebook and go to the back. There's going to be a summary of each of the 5 tools. Just get yourself acquainted with it. But there's no obligation to do anything with it at this time. I just want you to have it, just so you know that you can have some things outside of therapy to continue your learning. And that's it for session 0. Your as a therapist, you're wanting to get a few bits of information. You need to have the intake done because of insurance purposes and making sure you're having kind of that historical document that you can refer back to. I think outside of the intake, you're going to need to do a diagnosis. So depending on whatever the issues are clinically, you're going to put those in there as well. But as an ag therapist, we're really not concerned as much with the diagnostic name of whatever they're bringing. A lot of times, you can kind of squish them all down, and there's a lot of times it's a few things that are problematic. It's maybe the control. So if you're thinking of anxiety, OCD, those are a big time about control. The other one would be avoidance. So depression tends to have a lot of avoidance, panic attacks, or maybe PTSD. Those would have a lot of avoidance. Those would be the serious diagnostic categories that would fit within those two. But I find people are coming to counseling for a variety of reasons. There's sometimes like relational distress, or maybe there's problems with their kids. Maybe there's an adjustment or a stress issue at work or something in their life that has changed, and they're looking for counseling. And so as an ACT clinician, we're really trying to just kind of take a step back from the DSM-5, the diagnostic categories, and say, what is the life problem that this client is having? What are they experiencing? So a lot of times it's a shrinking of their life, that this problem is taking more and more room in their life, and they're needing help getting unstuck and getting moving toward what matters. So at the end of the intake, you should have enough information to start saying, okay, what are we going to work on next? Now, in the next video, I'm going to go over what I include in nearly all session 1. It's talking about control as the problem and willingness as the solution. Now, this is a pivotal session for clients to really buy in to what ACT offers, and it kind of sets it up as a counterintuitive approach. It's a paradoxical approach. It's something that it kind of gets that curiosity itch, and it's kind of that loop that they want to complete. And I'm not saying that in a manipulative way at all. It's just its ACT is so intriguing for people that they really want to take those next steps towards doing something different. And I think in therapy, regardless of the approach, doing something different is almost always better than doing the same thing and expecting a different result. So that's it for session 0 and kind of an introduction to this roadmap. I am going to develop a resource that's going to accompany this. So this is for therapists as well as those that are wanting to learn how ACT can help with their mental health. And so that'll be in the descriptions below. You can download that handout and utilize that. It's kind of a cheat sheet to help you throughout these 10 sessions. All right, if you're interested in learning more, go ahead and click on the next video and learn how or what to do in session 1 and focusing on willingness and control as the problem. Remember, your journey towards a more purposeful and mindful life begins with a single click.